Public health experts continue to push the importance of getting vaccines and booster shots, plus wearing masks. There are other alarming factors contributing to the spread of COVID.
In an op-ed in today's Los Angeles Times, one doctor explains that lung failure leads to COVID tragedies. Dr. Milan Han writes in her article that once the lungs fail, other organs soon follow, like a game of Jenga when the linchpin block is removed. Another troubling factor contributing to the spread of COVID are the risk factors stemming from the climate crisis, which is adversely impacting global air quality due to dust and particle pollution are rising due to hotter temperatures and drought. Also, wildfires are driving extremely high particle pollution levels as well, even affecting people many miles away from the original fire. Dr. Han adds in her report that all of these exposures induce lung inflammation, contribute to the development of chronic obstructive pulmonary disease, and exacerbate asthma.
Dr. Milan Han, the Chief of Pulmonary and Critical Care at the University of Michigan and author of Breathing Lessons, A Doctor's Guide to Lung Health, joins us now. Dr. Han, how do we turn this issue around, especially if COVID is going to become endemic?
This is such a great question. You know, at the beginning of the pandemic, I realized that there are so few people that really understand how their lungs work. And we also, I think, as a nation, don't really understand the risk factors that can lead to lung disease. We have a huge number of individuals in the United States that are undiagnosed, and in particular, our brown and Black communities are at increased risk. Now we're seeing increased cases of COVID, increased severity of COVID among patients with chronic lung conditions. And so for me, really, as a society, as a country, we have to start prioritizing lung health in terms of screening, research for how to prevent lung failure. You know, the severe forms of lung failure, acute respiratory distress syndrome that many patients with COVID die from, we didn't have good treatments before the pandemic. So we really need better national investment into understanding lung injury and treating lung injury if we're going to get through this pandemic, prepare ourselves for the next one.
So, Dr. Han, what are the possible negative effects we can experience if the issue of pollution, for example, is not solved? How will that impact us?
That's a really great question, and it's something that I do talk about in the book. But, you know, one of the interesting studies that you mentioned is that they looked at wildfires, for instance, in the West, and they found that last year there were almost in excess 20,000 cases of COVID and 750 deaths just from COVID, but related to excess air pollution just from the wildfires. We know that these kinds of exposures cause lung inflammation. And one of the most interesting things that we're finding is that at the University of Michigan, they did a study looking at patients with long haul COVID, and they found a significant number actually had undiagnosed lung inflammation on CAT scans prior to getting COVID and now have long haul COVID. So I think as a society and as a medical community, we really have no idea how much lung inflammation is out there, but the impact is real. It is increasing risk for getting COVID, and it is increasing the risk for severe disease.
What's increasing when it comes to post-COVID? And by that I mean, you say it's increasing the risk of getting COVID if you already have lungs challenged by pollution or asthma. What happens after you get the infection to your lungs?
Well, one of the things that's interesting is we now know, or there's a suggestion in this research, that pre-existing inflammation before you get COVID may predispose to long haul COVID. Long haul COVID, persistent symptoms after you get COVID, is something we're really trying to understand. But it's another reason why we've absolutely got to prioritize lung health in this country, because we're going to have a significant number of patients coming out of COVID who have persistent shortness of breath, and abnormalities that we're finding on CAT scan with respect to persistent inflammation, and in some cases, significant scarring for those who had really severe lung damage and, for instance, were on mechanical ventilators in the ICU. So I think we may be looking at a whole new population of patients with chronic respiratory disease in this country, which is yet another reason why we've got to prioritize diagnosing, screening, and treating lung issues.
So, Dr. Hahn, when you look at this, this is a problem. We have a problem. We haven't adequately dealt with it. And now it's compounded by the COVID pandemic, which continues to produce more variants. How does this impact our children who are already impacted by the growing number of asthma cases just related to traffic pollution alone? I think 2-something million children now have asthma. They're going to grow up in the midst of this COVID pandemic. How will that increase their chances of long haulers and also impact them for their future?
That's a great question, Kelly. And it's also something else that I mentioned in here. You know, asthma is a huge problem for children here in the United States, but I worry in particular about our Black community. So Blacks in general are 3 times more likely to die from asthma than whites. Black children have a death rate from asthma that is 10 times that of white children. And we know that things like poor air quality, either from, all the things like wildfires, et cetera, but also just traffic. Living in urban settings, schools that are too close to freeways, these can all both cause asthma as well as exacerbate asthma. And I think with everything I just mentioned that we're learning, we know that this type of inflammation, not only is it just bad for kids and it's going to make them sick, but it's also going to predispose them potentially to bad outcomes from COVID. So we know children, for instance, the rates of hospitalizations for children from COVID in the last week or two for the children under 5, this is our unvaccinated group, have really started to go up. So, vaccinations are important. We've got to protect our kids with surrounding them with vaccinated individuals. But ultimately, as a society, we've got to figure out how to deal with getting clean air for our children and protecting them from some of the bad things like asthma.
I'm so glad you're bringing this to light and keeping us informed about this. Thank you for joining us, Dr. Milan Hahn, the Chief of Pulmonary and Critical Care at the University of Michigan and author of Breathing Lessons, A Doctor's Guide to Lung Health. Thanks again for being a part of the show.
COVID continues to cause confusion for school systems across the country. We'll tell you how some schools are managing and their plans for virtual schooling. Next, When the World Tonight continues.